This is Uganda's border with the DRC in the southwestern part of the country. Across the border is the eastern part of the DRC, where cases of mpox have been reported in almost all provinces. It's one of the busiest borders, with hundreds of refugees crossing into Uganda every day.
In terms of health, we run an integrated system because that means like the partners feed into the district leadership of the DHO, and then the partners here and the district have already been trained on how to do the screening and how to identify the cases.
The continued inflow of asylum seekers means the risk of transmission is high. No cases of monkeypox have been reported here at the Bunagana border point yet, but authorities say they will continue maintaining strict hygiene protocols, and these include temperature checks and ensuring no one enters the country without first washing hands. Uganda Red Cross teams are on hand to monitor the situation. Community loudspeakers blare in all languages, spreading awareness on preventive measures and the signs and symptoms of mpox.
We are trying to sensitize people in us not greeting each other and trying to disseminate information via the radios and through the churches and other community gatherings, most especially through our meetings, the LOCs meetings and the security meetings and community policy meetings.
The district has also set up an isolation unit at a nearby public hospital where suspected cases can be taken for monitoring as they wait for test results. Any confirmed cases are transferred for further management to a bigger facility.
We have a trained case management team which comprises of about 12 people, nurses, laboratory, and the doctors who help us. So we are having a tent which we are temporarily using in case of any patient who comes in the hospital.
The World Health Organization warns of an upsurge of mpox cases in the DRC and an increasing number in several African countries. Uganda has responded to several outbreaks of viral infections like Ebola and COVID-19 in the past, and authorities say they are ready to bring an end to mpox as well. Isabel Nakiria, CGTN, Bunagana, southwestern Uganda.
So where are we with the mpox outbreak? According to the Africa Centers for Disease Control and Prevention, at least 4,000 new cases and 81 deaths were reported on the continent in the past week. This brings the total number of cases in Africa to over 22,000 and total deaths to more than 600. The Africa CDC says the continent experienced a 160% increase in cases by the end of July, compared to the same period last year. Central Africa remains the most affected region with smaller outbreaks in East, Southern, and West Africa. Outside the continent, the Philippines, Thailand, Pakistan, and Sweden have confirmed cases. Singapore and Malaysia have stepped up precautionary measures, including temperature and visual screenings at entry points, including airports. Meanwhile, ratings agency Fitch says that a rapid spread of the viral disease in sub-Saharan Africa could add to the fiscal pressures many countries in the region are already experiencing. Fitch says the main impact on economies would be likely on consumption and production. The economies of sub-Saharan Africa are still struggling after being severely impacted by COVID-19. Another potential impact might be on tourism, which according to UN projections contributed between 11 to 20% of all export revenues for products and services in Kenya, Rwanda, and Uganda in 2022. Fitch also noted that there would be difficulties controlling inflationary consequences, particularly if food supply and logistics were severely interrupted. Other potential problems included a reduction in tax income and an increase in healthcare spending.